Good morning, students. Today we will be covering scarring alopecias. Okay, it's a short topic. You have to remember few things. So, scarring alopecias or cicatricial alopecias, they come to us with complaints of pain, burning sensation, or pruritus. Okay, these are the complaints they will come to us with. And here signs of inflammation are present. In non-scarring alopecias, there were minimal signs of inflammation, or there was no inflammation, right? So here signs of inflammation are present, right? Now cicatricial alopecias can be primary or it can be secondary. Primary alopecias, they occur because of direct involvement of hair follicle, okay, and there is loss of hair. But secondary alopecias, the hair is damaged as a bystander effect. There was a trauma, there was a burn injury, there was a sclerosing disorder, there was any malignancy, and that led to, damage of the hair follicle as a secondary bystander effect. So, hair follicle here is damaged as a bystander effect, okay. Now let's look at the classification. See, it's a big classification of primary and secondary alopecias. Do not need to remember in detail all these conditions. So actually primary cicatricial alopecias can be divided on the basis of predominant infiltrate, right? If the infiltrate is lymphocyte, we have lymphocytic associated primary cicatricial alopecias. If the infiltrate is neutrophil, we have neutrophilic associated cicatricial alopecias, and then there can be a mixed infiltrate, right? So there are three subdivisions that we have in primary cicatricial alopecias. In secondary alopecias, cicatricial alopecias, it can be due to infections, it can be due to causes like sarcoidosis, it can be due to neoplasms, it can be due to exogenous injury like burns and traumatic scars, it can be due to hematomas. Psoriasis is something that usually leads to a non-scarring alopecia, but in some cases it can lead to scarring. So psoriasis and immunobullous disorders, right? These are rare causes of secondary cicatricial alopecias. Now we will be discussing CCLE, which is discoid lupus erythematosus, lichen planopilaris, and we will be discussing folliculitis decalvans, dissecting cellulitis. These are the four main conditions, and we'll also discuss pseudopelade of Brock, right? So these are the 4-5 main alopecias that you have to remember in scarring alopecias. But you do have to remember all the names, because then you can get a simple questions like which of the following is not a scarring alopecia, which of the following is a scarring alopecia. So if you know the entities just by the names, it becomes easy for you to solve that question, right? So let's move to lichen planopilaris. Now lichen planopilaris we discussed while studying lichen planus, right? It's involvement of the hair follicle. Now there are three variants of lichen planopilaris. First is the classic type. There is the classic lichen planopilaris, which we discussed in lichen planus also. The second is called frontal fibrosing alopecia, and the third is Graham-Little Picardy Lasher syndrome. Okay, big names. Just familiarize yourself with these three variants. Three variants of lichen planopilaris. See here. We had three types: the classical type, the frontal fibrosing alopecia type, and the Graham-Little syndrome. So these were variants of lichen planopilaris, right? Now the classic LPP is what you see here, okay? This is the classic lichen planopilaris. What do you get in classic lichen planopilaris? Just revise with me. It leads to patchy area of scalp involvement. It predominantly